Hello students, welcome back to my another video, and in today's lecture we're going to be discussing the gross anatomy of colon. Okay, so first of all, what are the parts of our colon? Colon has four different parts. First one is the ascending colon, the second one is the transverse colon, third one is the descending colon, and the fourth part is the sigmoid colon. We can see this in a diagram. This one was the cecum, this was the appendix, vermiform appendix, and this was the ileum. Then we have the ascending colon, the transverse colon, the descending colon, the sigmoid colon, finally the rectum and the anal canal. So first of all, we're going to be studying the ascending colon. So what is the extent of our ascending colon? It basically extends from the cecum to the inferior surface of the right lobe of the liver, meaning it extends from the cecum to the inferior surface of the right lobe of the liver, meaning that the liver is present above or superior to the ascending colon. Then we have its root. It basically bends to the left from the right colic flexure. Okay, this one is the right colic flexure and this is the left colic flexure. Basically it is an angle between the two colons. So it bends to the left to form the right colic flexure, and it is basically retroperitoneal, meaning that the peritoneum is not covering it entirely. The peritoneum is not covering the ascending colon entirely. So what are the relations of our colon, ascending colon? We have the anterior and posterior relations. Anteriorly we have the coils of small intestine, the greater omentum, and the anterior abdominal wall. Next we have the posterior relations, meaning the organs which are present behind the ascending colon. They are basically three different muscles: the iliacus, quadratus lumborum, and the transversus abdominis. Then we have the three nerves. These were the ilio-hypogastric, the ilio-inguinal, and the lateral cutaneous nerve. Then we have the right kidney, which is present on the posterior surface of the ascending colon. Now we have the transverse colon. The transverse colon extends from the right colic flexure to the left colic flexure. This we can see in the diagram, the right colic flexure and the left colic flexure. So the part of colon which is present between the right and the left colic flexure is known as the transverse colon. It basically extends from the right colic flexure to the left colic flexure. It hangs as a loop and is not transverse. We saw in the diagram that the transverse colon was not straight or transverse. It was basically hanging like a loop, and it is intraperitoneal, meaning that the peritoneum is covering it from both sides, in front and behind. Now we have the relations of our transverse colon, the anterior and the posterior relations. The anterior relations contain the greater omentum mainly and the anterior abdominal wall. The organs present behind the transverse colon are the second part of the duodenum, the head of pancreas, and the coils of small intestine. Now we talked about the two different flexures, the right colic flexure and the left colic flexure. So the right colic flexure is also known as hepatic flexure because the liver, it is present immediately above or superior to the right colic flexure. So we have the differences between the right and the left colic flexure. The right colic flexure, the hepatic flexure, is placed anteriorly on the right side. It is placed on the anterior portion on the right side, whereas the splenic flexure is placed posteriorly on the left side, meaning that it is placed posterior to the organs, to the peritoneum on the left side, and the hepatic flexure, it is placed on the anterior to the peritoneum on the right side. So the hepatic flexure, it makes an angle of 90 degrees between the ascending colon and the transverse colon, whereas the splenic flexure makes an angle less than 90 degrees between the transverse colon and the descending colon. The hepatic flexure, it lies on the right kidney, whereas the splenic flexure lies on the spleen. The hepatic flexure is supplied by the right colic artery, obviously because it is on the right side. The splenic flexure is supplied by the left colic artery because it is on the left side. So hepatic flexure has no ligaments attached, whereas on the splenic flexure we have a phrenico-colic ligament that gives it support. The hepatic flexure is present on the L2 vertebra region, whereas the splenic flexure is a little above and it is present on the region of 12th thoracic vertebra. Now we're going to be talking about the descending colon. The descending colon extends from the left colic flexure to the sigmoid colon. Okay, the descending colon extends from the left colic flexure to the sigmoid colon. So it is basically, the descending colon is basically narrower than the ascending colon, and it is retroperitoneal, just like the ascending colon. First, so now we're talking about its pathway. First, it ascends vertically to the iliac crest, meaning that it first goes upwards and then it inclines medially on the iliacus and psoas major muscles to reach the pelvic brim. So first of all, the descending colon arises upwards and then it goes medially below between the muscles, the iliacus and the psoas major, till it reaches the pelvic brim, and on the pelvic brim the sigmoid colon is started. Now we're talking about the relations of our descending colon. The organs present on the anterior surface of our descending colon are the coils of small intestine, and posteriorly we have the transversus abdominis muscle, the quadratus lumborum muscle, the psoas major muscle, and the 5 nerves: the iliohypogastric nerve, the ilioinguinal nerve, the lateral cutaneous nerve, the genitofemoral nerve, and the femoral nerve. And then we have the gonadal and the external iliac vessels, blood vessels present on the posterior part of the descending colon. Finally, we have the sigmoid colon, which is also known as the pelvic colon. It extends from the pelvic brim to the S3 segment, and then it becomes the rectum. So the sigmoid colon starts from the pelvic brim, then from the pelvic brim the sigmoid colon is started and it goes till the S3 segment, where it becomes the rectum, and it is totally intraperitoneal, completely covered by the peritoneum. We have its anterior relations, which are the coils of small intestine again. Now we're talking about the blood supply of our colon as a whole: the ascending colon, the transverse colon, the descending colon, and the sigmoid colon. First of all, the ascending colon has its branches of the ileocolic artery and the superior mesenteric artery. First is the colic branch of our ileocolic artery. Then we have the anterior cecal artery of the ileocolic artery. Then we have the posterior cecal artery of the ileocolic artery. And finally we have the right colic artery, which arises from the superior mesenteric artery. Then we have the transverse colon. We have 3 different branches from the superior mesenteric artery. These are the right colic artery, the middle colic artery, and the left colic artery. We have the descending colon, which gets its blood supply from the right colic artery, which arises from the inferior mesenteric artery. Okay. And then we have the sigmoid colon, which is supplied by the inferior mesenteric artery. The sigmoidal branches arise from the inferior mesenteric artery, which supply the sigmoid colon. Similarly, we have the venous drainage, which is quite similar to the arterial supply. We just have to substitute the name artery with the veins.